Good evening, everyone. Today's webinar we begin with the understanding of polycystic ovarian disease or polycystic ovarian syndrome, as you all know. And let's understand how naturally we could treat it. The Hale Clinic does that, and a lot of patients have been benefited by this. Now, let's understand how we treat it naturally. Let's understand what the disease or the syndrome is all about, and how we can treat it naturally. So basically, in the Hale Clinic, we consider diet therapy, yoga therapy, and of course, there are natural herbs that we use for this. And why do we use these herbs? Why these yoga asanas are trained to the patients? Why the specific diet is given? What is all about PCOD? Let's go ahead with that. Basically, the cases that I get here, um, I'm seeing it in young girls nowadays. A lot of young girls are college-going students, and the students who are in 11th and 12th. I mean, the disease is starting, or the syndrome has started showing its changes very early in the life. So let's understand. So basically, if a patient comes to me, I can just recollect one of the cases. It was an 18 years old girl and studying in the first year of graduation. Visited the clinic, the Hale Clinic, on complaint of irregular menstrual cycle and weight gain. Though the appetite did not decrease, from past 2 months, these were the complaints. It was irregular menstrual cycle. Irregular menstrual cycle in the sense she was not getting the periods from past 2 months. And there was a weight gain, but the appetite did not increase. She was not hungry, she was eating the regular diet, whatever she used to take, but still there was a significant weight gain. Now, when the clinical examination was done and further lab investigations were done on a complete blood count, hormonal assay, and ultrasonography of the abdomen, it was diagnosed and confirmed to be a case of polycystic ovarian syndrome. Now, let's understand what is PCOS or polycystic ovarian syndrome. Polycystic ovarian syndrome is a female clinical condition in which there is an increment of male hormones. So in India, we see a lot of people or a lot of women suffering from this in different age groups, and it's between 5 to 15% of the noted cases that we statistically could represent. Let's understand what are the complaints that we get on this health complaints. So it's oligomenorrhea. What is oligomenorrhea now? It is irregular menstrual cycle as in prolonged amenorrhea. Amenorrhea is there is no menstrual cycle, missed periods. So oligomenorrhea is one of the health complaints. Dysfunctional uterine bleeding is there. What is dysfunctional uterine bleeding? It is an irregular menstrual cycle with excessive uterine bleeding. Weight gain is undefined. The appetite does not increase, but a significant weight gain, plumpiness in the body or heaviness in the body can be easily noted. Hirsutism. What is hirsutism? Hirsutism is display of masculine features like hoarseness of voice, male body contour, acne, etc. Hyperpigmentation is one of the other complaints. Hyperpigmentation is skin color darkens and especially visible in skin folds like around the neck, armpits, etc. Let's understand. So basically, I hope you guys understood what are the health complaints. It's oligomenorrhea, irregular menstrual cycle, dysfunctional uterine bleeding, irregular menstrual cycle with excessive uterine bleeding, weight gain is undefined, hirsutism is display of masculine features like hoarseness of voice, male body contour, acne, etc. Hyperpigmentation is skin color darkens and especially visible in the skin folds. The back of the neck darkens, the armpits are darkened. These are basically the complaints that the patient comes with. It could be all the complaints or few of the mentioned complaints. Now let's understand from where did a bit of history of PCOS. From where did it initiate? How was it pictured in the medical field? So, Stein and Leventhal are regarded to have been the first investigators of polycystic ovarian syndrome. However, in 1721, Vallisneri, an Italian scientist, described a married infertile woman with shiny ovaries with a white surface and the size of pigeon eggs. It was not until the early 1990s at a National Institute of Health sponsored conference on PCOS that formal diagnostic criteria was proposed and afterwards largely utilized. Many scientists tried to explain the pathophysiology of PCOS and many studies were made. It is now globally accepted that it is a multifactorial, partly genetic. However, a number of candidate genes have been postulated. Insulin resistance has been noted consistently among many women with PCOS, especially in those with hyperandrogenism, but it is not included in any of the diagnostic criteria. Now, there is a strong evidence that cardiovascular disease risk factors and disturbance in carbohydrate metabolism are all increased in patients with PCOS compared to the healthy population. The criteria established by the group of experts during a conference in Rotterdam held in 2003 are obligatory. The Rotterdam sponsored PCOS consensus workshop group. The subsequent Rotterdam criteria incorporated the size and morphology as determined by an ultrasound of the ovary into the diagnostic criteria. Now let's understand the basic pathophysiology of the disease according to the Unani concept. So, according to the Unani concept, the disease is caused by the imbalance of the phlegm humor. So, if there is an increase in the phlegm humor, this condition is displayed as weight gain and missed periods, the symptoms that we were talking about, and the treatment is also based, and there will be involvement of liver disorders in this. So basically the treatment also postulates around the same, which we will discuss further in the next in the coming topic in some time. So let's understand what are the basic complications of PCOD. The basic complications of PCOD include infertility. So this is like one of the PCOS is like one of the main causes of female infertility as it prevents ovulation. Women who conceive with PCOS have higher chances of premature delivery, gestational diabetes, that is diabetes during the pregnancy, high blood pressure, and even miscarriages. Insulin resistance is also noted, so there are chances of diabetes increase to to almost 40% in females suffering from PCOD. While these long-term conditions like heart disease and type 2 diabetes or diabetes mellitus can be prevented if the treatment is done on time and the person can get healthy. One of the other complications is metabolic syndrome, and there is another one which is carcinoma of breast and endometrium. Due to the prolonged illness, due to the prolonged imbalance in the hormones, in the humors, these are the complications that a person finds in a longer duration of time. Let me see if there are any questions. Yes, there is a question here by Mao Adhikari, and she asked me how is PCOS diagnosed. So we discussed in the earlier part of this session. It is being diagnosed with the blood investigations, with is complete blood count, hormonal assay, ultrasonography of abdomen, to confirm the case. Now let's understand how and what are the causes of PCOD. So basically, scientific research has proven that sedentary lifestyle of modern civilization perpetuates PCOD. That is the reason there are a lot of young girls that I'm getting nowadays with this condition. And most of the time they are not involved into physical activities, and even the diet form has changed. Most of them are inclined towards junk food, and thereby causing an imbalance in the metabolism, in the hormones, and ultimately it's PCOS, polycystic ovarian syndrome, that we are seeing. So let's understand how it happens. So basically, it begins with a sedentary lifestyle when there is no active physical activity involved in the lifestyle. Most of the jobs that we are seeing today involves long hours of sitting, and the people, after sitting and working for long hours in front of the system, people get exhausted mentally and physically, and they don't consider any time that remains for them to have an active physical activity wherein they could walk. A brisk walk is one of the best things that one could do to avoid such hormonal imbalance conditions. So let's understand. So, once there is a sedentary lifestyle that begins with, there is an increased cravings of junk food. And once someone starts with the cravings of junk foods, try to feed those cravings with the junk food, the emotional and behavioral disturbances start displaying, like highly competitive attitude and social insecurities. And once this gets into the attitude and habits of a person, it disturbs the HPO axis. HPO is hypothalamus pituitary ovarian axis. And once that gets into place, when the HPO axis gets disturbed, it perpetuates lifestyle diseases like PCOD. PCOD is basically considered as a lifestyle disorder and treated accordingly. So let's repeat this again. It begins with a sedentary lifestyle wherein it increases the cravings of junk food, and it causes, and once person is on a junk food, because there is no proper nutrition that one is getting, it impacts the emotional and behavioral disturbances, and then disturbs the HPO axis. HPO is hypothalamus, pituitary, and ovarian axis. Ultimately, the lifestyle disorder as PCOD. A more recent joint consensus statement between the European Society for Human Reproduction and Embryology and the American Society for Reproductive Medicine has revised the criteria for diagnosis of PCOD to include two from three of the following criteria. So one is oligomenorrhea or anovulation, which we discussed in the clinical conditions. Second one is clinical or biochemical evidence of hypoandrogenism. Third one is polycystic ovaries with the exclusion of other etiologies or other causes. Let me see if there are any more questions. Okay, there's one question from Nancy D'Souza which says, will being overweight lead to PCOD? PCOD leads to overweight, that I would say rather, and then the causes of overweight has to be checked, whether it is due to imbalance in the hormones or whether it is due to the eating habits or the diet habits. That has to be analyzed clinically, and then we can confirm what is the cause for PCOD and what is the cause of overweight, and then the treatment line can be decided, or the management of the disease can be decided based on the clinical analysis. There is another question from Mao Adhikari saying, what can I do on my own to lessen PCOS symptoms? Yes, we are coming to it. There are a lot of things that people can do it on their own, because this is basically a lifestyle disorder. and it is very much in control of one's own being to avoid it or to prevent it. Let's understand that. So basically, in modern science, PCOD is treated, or polycystic ovarian disease is treated symptomatically with hormonal replacement therapy. But in Unani system of medicine, the line of treatment or the treatment protocol differs. It is basically to rectify the metabolism. It is basically to I mean, we give uterine tonics to basically enhance the uterus tone, and then there are lifestyle changes that are being trained and taught to people here, wherein they could adopt the lifestyle. So the lifestyle has to change. That's the reason it takes a couple of months of treatment. Obviously, there are drugs which are given, natural drugs which are given, but then apart from that, it's a lifestyle change. So basically, the treatment goes from 1 to 3 months. The results are seen very well from 15 days or to a month, but then it has to be continued. It has to get into the lifestyle of the person. So let's understand how the treatment is carried at the Hale Clinic, or based on the Unani system of management. So what we try to do here is we understand the nature of the illness and treat accordingly to get the best and sure results. The first thing that is done here is that is to be done as a treatment protocol is detox. So detoxification is of prime importance to rectify lifestyle disorders and make any other drug effective on body. Individual temperament is evaluated, and based on temperament, detoxification method or drug is chosen. Pharmacotherapy, so for drugs that we use here, all are natural drugs, and these are given to dissolve cyst and regularize menstruation. So basically, aminogogues are the drug class that is being used here. Drugs used are Juniperus communis, Asparagus racemosus wild, Linum usitasimum, Glycyrrhiza glabra. So let's understand how these drugs act to a certain extent. So talking about juniperus has a history of medicinal use dating as far back as 1550 BC. A remedy to treat tapeworm was found from ancient Egypt 240 BC. It is also known that the branches and berries were burned in temples as a part of purification ceremonies. Being an emmenagogue, juniper is used in Unani treatment of PCOD. This helps in normalizing the menstrual cycle. So basically, there have been a lot of recent lab investigations done on these drugs, and they have been proven quite effective in the treatment of PCOD because of their specific actions on the specific organs, on like uterus, ovaries, and on the hormones. Now, the next drug that I mentioned was asparagus. So how it helps us? It helps in promoting normal development of ovarian follicles, regulates menstrual cycle, and revitalizes the female reproductive system, mainly due to its phytoestrogen. It's a natural plant-based estrogen. It also helps in combating the hyperinsulinemia. So if hyperinsulinemia is getting fought against, then the liver function, the pancreatic function improvises, and the chances of getting diabetes mellitus or diabetes type 2 lessens. The other drug that I mentioned here was linum usitacismum. There was a study done by Shiraz Institute in Iran to confirm the efficacy of this drug on PCOS, polycystic ovarian syndrome. So the study has given very good, promising results, and it says that the linum usitasimum extract improves serum sex steroids. It also corrected ovarian histomorphology in polycystic ovarian syndrome. It also attenuated ovarian histomorphometric indices in polycystic ovarian syndrome. So, treatment of polycystic ovarian syndrome with linum sitacinum extract significantly decreased level of testosterone, which is male hormone, in the treatment group, and compared to the PCOS group with no significant differences with the control groups. And similar to the findings in a case study on a 31-year-old woman, the study in the Shiraz University says that it was reported that the supplementation from linum for a supplementation of 30 grams per day for 4 months reduced testosterone levels. So basically, this drug has a negative feedback on luteinizing hormone. That is how it has worked in the rectification of the syndrome. Diet. This is what we were talking about. So diet is very important as to what are the eating habits of a person that causes the lifestyle disorders. So let's understand this way that changing the way you eat can help you manage the symptoms much better. PCOD symptoms are aggravated with consumption of certain types of food. So staying away from refined flour, sugar, dietary products, and carbohydrates helps to greatly reduce insulin imbalance and associated symptom occurrence. Replacing such foods with raw fruits, green leafy vegetables, and foods with a low glycemic index helps to maintain the nutrition value and also aids weight loss. So what is it that we need to avoid here? We will repeat it again. It's basically the refined food. So refined carbohydrates such as white bread, muffins, pastries, sugary desserts have to be avoided. So most of the time I say this, not to have sugar and salt in high quantity. Sugar is like almost kind of a sweet poison rather that I would say. So instead of sugar, you can replace it with jaggery, and you can replace the regular salt with the crystallized salt. That helps a lot, goes a long way to rectify to or to avoid or to prevent lifestyle disorders. The other thing that we need to avoid in food is the food which has high glycemic index, such as white rice, mashed potatoes, rice cakes, muffins, or any sort of cake. Because cakes are prepared with refined flour most of the time. So basically, when we are saying that refined flour is to be avoided, anything made with the refined flour should be avoided. Most of the bakery items basically are to be avoided. Dairy products are to be avoided because most of the dairy products have specific hormonal content in that, and that definitely causes an imbalance. So that is to be avoided. Soy products are to be avoided because of the glycemic index in the soya. It is to be avoided. Okay, these are the things in diet or in food items that we need to avoid. Now, what is the best food that we can have to prevent PCOD, or during, even if PCOD has been diagnosed, what is the best thing to have in the diet? Green leafy vegetables, fruits, healthy fats such as omega-3 fatty acids, which are abundantly available in nuts, seeds, oily fish, avocado, and olive oil. Lean protein sources such as tofu, chicken, and fish. Tomatoes are rich in lycopene, and that's very good for metabolism. Let me see if there are any questions here. Okay. Yes, one of the questions. by Nancy D'Souza that I see here is if what are the diet recommendations for PCOD? That's what I'm talking about now, and I hope I'm answering your question. And then, okay, by Mo Adhikari, I see a question here. Are some ethnicities more prone to PCOS? Basically, what I would say here is it's a lifestyle disorder. Of course, ethnic effect would definitely be there, but then when we are talking about a lifestyle disorder, it's on one's own lifestyle that one develops these conditions. So if I want to prevent it, I have to take care of it. Basically, I mean it's as simple as that. And then, how does polycystic ovarian syndrome affect fertility? The question from Mawadhikari. Okay, because as we discussed in the causes of PCOS, that the male hormones increase in the body, and, and obviously it impacts the fertility of a woman. Once it impacts the fertility of a woman, it definitely impacts the pregnancy. Okay, there's another question by Monica Rathod, wherein she says, is PCOD increase risk of endometrial cancer? Yes. So if PCOD or polycystic ovarian disease is not treated properly and not diagnosed on time and not treated, and the condition persists for a longer duration, studies have shown that it results in endometrial cancer, even breast cancer, because of the changes in hormones and a lot of stuff. It directly, basically, I mean, we have understood, right, how the axis, the HPO axis gets impacted. Hypothalamus is situated in the brain, pituitary axis, and then the ovarian axis. So the release of hormones from the hypothalamus itself gets imbalanced, and that is how there are chances of carcinomas or cancer. There's another question that I see here from Nancy D'Souza. It says, should we exercise when we are diagnosed with PCOD? Yes, I was coming to this. Physical activity is at most important to avoid any sort of lifestyle disorder. Basically, if I'm talking about any physical activity, it should be a minimum of a brisk walk for 30 minutes, at least thrice a week, is the basic expectation to lead a healthy life. There are, but once someone is going through the treatment of PCOD, we help here with the specific yogasanas. We teach them yogasanas that effect on the female reproductive organs to improvise the oxygenated blood circulation towards the female reproductive organs so that the disease gets treated quickly and the response is better. So once it, so that's the reason only for yoga therapy and these specific regimental therapies that the duration of treatment goes to around 3 to 4 months. Or else with medicine, the changes that we see are very promising, and people then lead healthy life. So basic thing to avoid any lifestyle disorder is a 30 minutes brisk walk, at least minimum thrice a week. There are regimental therapies apart from the rest of the treatment of natural drugs, yoga therapy, diet therapy that I talked about, that we follow in the Hale Clinic in Bangalore. We even let the case or the patient go through steam bath therapy. It helps in detoxifying the skin to remove the toxins beneath the skin. And to a certain extent, in few studies, it has proven to reduce weight. Cupping therapy is also done on specific anatomical sites to promote healthy blood to the ill organs. So this is the treatment protocol that we follow according to the Unani principles, Unani system of medicine. And now I would proceed with another question here. Um, Okay, this is a question from Mohdikari, wherein she asks, if I have polycystic ovarian syndrome, should I see a fertility doctor before trying to conceive? Yes, it has to be treated before conception, or else it leads to gestational diabetes, and the pregnancy may also not continue for its complete duration. Nancy D'Souza asked me any natural way of treating PCOD. Yes, basically, we can prevent and avoid any lifestyle disorder. Apart from that, if someone is suffering from PCOD, then we can help at the health clinic with a natural treatment. That's what the treatment plan or the protocol that I discussed some time back, which includes pharmacotherapy with natural drugs, and these drugs are scientifically proven to treat such conditions, PCOS, PCOD conditions, hormonal imbalance. And apart from that, yoga therapy. Apart from that, diet therapy. We give a specific diet plan or a diet chart for the cases, understanding their dietary habits. This we do here as because there are people who eat only chapatis, for example, in the northern part of India, and there are people who consume more of rice in the southern part of India. So we need to, and I just can't ask them to suddenly stop everything and stick to a salad or stick to a very rigid diet. I can't expect them to do that if I have to treat them. So I need to understand what one eats personally, and then chart out a diet chart accordingly. I see another question here from Kathy Soni. Where is your clinic, doctor? Is there any medicine you can help us with? Is the clinic consultation available? So basically, the clinic is located in Kadrinahalli in Bangalore. You will get a link in the Heal Clinic page itself. Yes, there are a lot of medicine, lot of natural treatment that we do here, basically to rectify the condition itself. And apart from that, there are natural therapies that we request and take the patient through that so that the lifestyle itself changes. Is the call consultation? Yes, call consultation is also available. So you can just go through the page and get the information. There's a question from Sayeda wherein she asks, what can I do on my own to lessen PCOD symptoms? To lessen the symptoms, basically the lifestyle has to be changed. Of course, diet has to be considered as to what one is eating, and the other thing is the physical activity. So there are specific yogasanas and basic activity that I request for anyone to avoid any lifestyle disorder is to take a brisk walk 30 minutes a day, thrice a week. And I believe I've answered almost all the questions. If there are any more questions, you can just put it across and I'll reply to it. And let's see to a healthy life. Good evening, everyone. See you in the next webinar, which is coming very soon. Thank you.